Dr. Sib in London. Getting a lot of questions again from my website. I'm here with Barbara. And what's the first question, Barbara?
First question is from Daisy. She's 29 years old and started to feel bothered about her deep nasolabial folds. Everybody is, I have to say. Get so many questions on that. And volume loss in her midface as she ages. It makes her look tired, angry, especially under certain lighting. What procedure do you recommend to correct this?
So that's a good question because it's a very common one. And 29-year-old starting to develop nasolabial folds and possibly a little bit of deep fat loss. We're not sure why. But nasolabial folds, these folds here, are the first signs of aging typically that we see, or when we're looking in the mirror, you'll start to see these folds develop. And this is usually as a result of tissue descending from the midface and giving rise to these folds. So the treatment for that is to use fillers. We're back to it, lifting again. So we're using small amounts here to give the lift. We're not really interested in creating too much volume here. We don't want someone to look unnatural. Now, if she's also lost fat in the deep plane, this can occur with the younger patient who has perhaps been on a diet or has been doing a lot of gym work, or nowadays using Ozempic. So we're seeing fat loss typically in the deeper plane, the deep tissues, and so we're therefore going to be using some filler into the deep areas and just giving a little bit of volume to restore that as well. I think that's it, really. Yeah.
Okay. Our next question is from Wendy. She's asking, I have had Botox, and when I'm indoors, I have no frown lines and have a tiny amount of movement when trying to frown. However, when I'm outside in the sunlight, my frown lines are so strong and deep, it doesn't make sense to me. Do I need fillers as well?
That's another good question. And I actually have come across that quite a bit. I think the thing is that you tend to squint more when you're in bright sunlight. So you're tending to create more frowns in this area here particularly. And that's an area where we use Botox, and I still use that in patients moving into their 60s and 70s because it gives me brow lift. It lifts up the brow here to create more of a youthful, refreshed look. And I think that when you are in sunshine a lot, you're frowning a lot. So then I have seen this where perhaps the Botox doesn't last as long. And so sometimes you have to give a bit more if you're in a hotter climate. Obviously, if you're indoors, the light is more subdued. You're not tending to squint. You're not tending to frown so much, except when you're using these devices, these computers and phones, where I think we're seeing that as more frowning in the youngsters. And I think that's a consequence of them using these devices. Yeah.
Okay, good answer. Our next question is from Olivia. She's 34 and she wants to know which procedure would minimize the droopy appearance of the right side of my mouth. What treatment could be done to get rid of or at least minimize the drooping on that right side? And I have to say, we get a lot of questions on drooping on around the mouth. In fact, we get a lot of questions about everything around the mouth. But she did send a picture, so why don't you take a look?
Thank you. And again, another good question. And also thank you for sending in a photograph because it does, from my point of view, it's very useful to see these things. Mid-30s, I mentioned earlier that we see nasolabial folding as one of the first signs of aging. As we then progress, we start to see what we call the formation of jowls, typically the lower part of this mouth here, starting to create a fold. And again, in the photograph, you can see the nasolabial fold higher up, and you can see the jowl lower down. There are In a younger patient, there are two ways, or there's more than one way, but there are essentially two key ways of treating this. Number one, you can actually use Botox because there's a muscle here which can pull things down. It's called the depressor angular oris, but if it's strong and it's pulling things down, pulling the corners of the mouth down, then if you know where you're injecting, be careful, because if you get it in the wrong place, you can cause the droopiness to be worse. But if you can use the Botox and the muscle is strong, then you will release that pulling down and it will give the lift. The other thing to consider is using a filler, and we're looking again to use fillers in a higher plane up here to give the lift. So we're back to that lift aspect again. So we're looking to create lift. The jowls are also affected by loss of support here in front of the ear. So again, if we're starting to see volume loss here, we're going to have to address that issue. And there are a couple of products that we can use, such as Structura in a younger patient, which is like Profilo, or we can use Harmonica, which will address skin laxity in this area and give us a tighter skin here. The other thing that we can use is very fine fillers, and we can use them in the lower third, the lower part of the face. We want to use something like that because we don't want to create too much bulk or heaviness. And we use it across the top of the muscle in a fan shape. And the idea there is to stop, again, the muscle pulling things down. So it's a myomodulating effect. And we want something that's fine as well, as I said, not to create too much bulk. So there's a couple of combination techniques, products that you can use to address that problem. Yeah.
That's it.
Yeah, that's it. Please go to my website. Please submit more questions, more photographs. I love seeing them. And I'll speak to you at the next Q&A. Thank you.